When an individual comes to see a neuropsychologist, they anticipate, it'll be like another physician appointment. We'll be there for 10-15 minutes. What we do takes more time. So when an individual gets an MRI or a CT scan of the brain, it shows a picture of the brain, but it doesn't tell how those different areas of the brain are working. People with moderate stage Alzheimer's dementia can have a perfectly normal looking MRI of the brain, but we are well aware that the brain isn't working as it should be. That's what the neuropsychological assessment can do. It assesses different areas of brain function, including, of course, memory, attention and concentration, higher level thinking skills, planning, reasoning, judgment, language functioning, visual processing, and then we also usually will screen for things like depression or anxiety. Those certainly can have an impact on thinking. When a patient comes to see us, we'll go through a variety of different tasks. These tasks are all designed to determine how those different abilities are working. And we're looking for averages. So if most things that the person is doing fall within the average range compared to others their same age and education level, then okay, they're falling within the average range. But if something falls down below the average range, maybe even into the impaired range, that tells us that that area of the brain is not working well. And then we go from there to figure out diagnosis and treatment. There is a whole host of things that can cause a change in thinking. We talked about things like dementia. Dementia is a broad term that refers to any change in thinking. Now, Alzheimer's dementia is a type of dementia, but certainly not the only dementia. There can be changes from vascular function. If there are blockages in the arteries of the heart or in the carotid arteries, then it's fair to expect there might be some of those that occur in the brain as well and can cause more subtle changes in thinking. Now, of course, a stroke can cause change in brain function, but other things like multiple sclerosis, epilepsy, or seizure disorders can also cause some changes in thinking, Parkinson's disease, and there's always the unknown. The referral question I see fairly regularly is, we're noticing a change in mom's memory, or John has noticed that he's not as sharp in his thinking and not remembering. So sometimes patients themselves will bring this to their physician and we're not sure what's causing that. So they'll come see a neuropsychologist to help parse out what might be going on. And again, how can the healthcare provider assist with improving those issues? The neuropsychological assessment provides information as to different areas of thinking strengths and weaknesses, and from that flows recommendation, both for the physician for intervention. Might medication be necessary? Might the individual need an MRI to check further for any vascular changes in the brain? And then we also make recommendations on intervention. So would this patient benefit from a few sessions with speech therapy to address cognitive strategies using a memory book or other memory strategies? And then there are also times when I will include strategies the patient can implement right then and there to help with memory or help with attention and concentration. My desire, and I think many people's desire, is to stay in their own home, be as independent as they can be, to not have to depend on others to go get groceries or to go to doctor's appointments. And whatever we can do to help with that is in the best interest of not only the patient, but also our community. So if people are happy in their home, but are safe in their home, and there's some safety checks or safety nets for them, everyone benefits from that.